Hello. Today I will be speaking about predicting mental health seeking intentions using the theory of planned behavior. The purpose of this study was to examine how attitude, normative pressure, and perceived behavioral control influence intentions to act on a desired behavior. In order to find this out, we use the theory of planned behavior to assess these intentions. More specifically, we assess participants' intentions towards seeking mental health counseling within the next 3 weeks based on these factors: attitude, PBC, and normative pressure. Let's go over some definitions. Number 1 is attitude. Attitude is what you think of a desired behavior. Number 2, intention, the likelihood you'll actually engage in that desired behavior. Number 3 is perceived behavioral control. This is the perception of whether or not you are capable of performing that certain behavior. Number 4 is normative pressure. Normative pressure is what other people who are important to you feel about the behavior. The theory of planned behavior is the assumption that individuals will behave rationally based on their attitudes, subjective norms, and perceived behavioral control. As you can see in this figure, it shows that all three of these things go into intention that then alternate or influence a certain behavior. However, these aren't always the case for decision making. Sometimes you can have an attitude that goes into an intention, but not have these other factors that influence that specific behavior, as we'll see later on. There's been a lot of research done about the theory of planned behavior. More specifically, I wanted to focus on the social stigma as well as one's attitude that goes into these intentions. According to Bayer and PA, social stigma or overall attitude of a society may cause individuals to have a flawed perception of mental illness, as people may be reluctant to define themselves as having a problem that warrants professional attention. This social stigma may also be attributed to the lack of seeking professional mental health assistance. Another thing I wanted to talk about is attitude, that also goes into behavioral control. Researchers have shown that individuals showed less fear and social stigma after attending just one counseling session, yet getting to the point of attending that one session is more difficult than one might think. This would be different factors going into the intentions to perform a certain behavior. When it comes to mental health, the social stigma surrounding mental health, as well as the attitude about what one might be seen as or what they can do within the mental health setting, is really important for this research. In order to assess these mental health intentions, we sent out a survey that had to do with the theory of planned behavior and questions associated with attitude, normative pressure, PBC, as well as intention. What we did was send out this questionnaire via Instagram, Facebook, and Survey Circle. We informed that the survey would measure their beliefs and attitudes about seeking mental health counseling within the next 3 months. We also asked about their demographics, and they were also given a consent form before the survey and then after thanked for their time. The participants within the study were all adults over the age of 18, both male and female. Although we got way more females than we did male, with 85% being female and only 15% being male. Out of these, only 15% were Black or African American, while 85% were non-Hispanic white or Euro-American. The ages of the participants range from 20 to 29 years old. The survey asked questions on a 7-point scale for each of the different factors. For attitude, an example of this question would be, for me, seeking and receiving mental health counseling in response to distress within the next 3 months is, and then it would range from either pleasant to unpleasant, good to bad, or comfortable to uncomfortable. The reliability of this attitude assessment was 92%. The perceived normative pressure was also on a 7-point scale, with questions such as, most people I admire would seek and receive mental health counseling when experiencing distress. They would then answer on a scale of 1 to 7, unlikely to likely. The reliability of this assessment was 68%. Perceived behavioral control was also assessed using a 7-point scale. These questions ask things such as, I am confident that I can seek and receive mental health counseling when I am distressed during the next 3 months. Answers for this may include 1, definitely false, to 7, definitely true. The reliability of this assessment was 76%. We then go to behavioral intention. This is also on a 7-point scale and had questions such as, I will make an effort to seek and receive mental health counseling when I am distressed during the next 3 months. They then could answer on a scale of 1 to 7, from strongly agree to strongly disagree. The reliability of this assessment was 95%. In this specific study, attitude was the most statistically significant predictor for intentions to seek and receive mental health counseling. Attitudes towards seeking and receiving mental health counseling were overall positive, with a mean of 5.28, standard deviation of 1.21. This contrasts my original hypothesis that many individuals' attitudes towards seeking and receiving mental health were overall negative. However, one's attitude was the most significant predictor, showing that some, if not all of these factors within this theory can be analyzed to understand and predict intention. Overall, attitude was the only significant factor when it came to intentions within this study. However, the implications of this study can give way more understanding to the intentions and the prediction of behavior. My hypothesis was wrong. Had the idea that many people were very negative about mental health, but this actually showed me that individuals' attitudes towards seeking and receiving mental health was overall positive. The previous research has shown that each factor, as discussed in the theory of planned behavior, can influence individual intentions. However, there is still way more research to be done in order to show stronger implications for behavioral intentions. Many of the ones I saw mostly involved normative pressure and its influence on attitude to affect intention rather than the other factors as we discussed in this PowerPoint. The limitations of my study were that there was a small sample size with only 13 participants. Most of the participants were female, over half, almost all of the participants were female, and I didn't have a wide range of ages, which the ages were mostly 20 to 29, which doesn't give us a full picture of everyone's intentions to seek mental health assistance. My suggestions for future research would be to have larger and more diverse sample size, as well as a wider range of ages, as it could show a more diverse understanding of these intentions of all individuals. Another thing future research could possibly do would be to look at more of these background factors that go into predicting the intentions, but also the behavior in turn. The factors that we mentioned here are very important, and I believe they should be something to consider when thinking of planned behavior. However, I think it's also important to note that there are so many other factors that go into the intentions of people to actually act on a desired behavior.